Sleep is at least as important and possibly more important than food in quality of life and quantity of life. If a person is sleepless, their mood changes, their behavior changes, their weight changes, their blood pressure can change.
Sleep medicine is basically taking care of children and people who have sleep problems, and that is anything ranging from insomnia to sleep apnea to problems where people are excessively sleepy during the day, like narcolepsy or hypersomnia.
We see very complex patients that have many comorbidities, but if you treat their primary underlying medical problem and you ignore sleep disorder, then you're really missing treatment of an essential part of the child's management.
We have the only dedicated pediatric lab in the Chicago area. And what that means is that our technicians only work with children, and they're so used to working with the full spectrum of pediatric patients.
We collaborate well with our physicians to have a great outcome and get the best results for the patients that have been sent to us. Once the physician has seen the patient, written the order, we perform the sleep study, and I'm monitoring them to see if they have any obstructive sleep apnea, if they're retaining CO2, if they're moving excessively, where they're kicking and twitching while asleep. I'm looking and documenting that, and always looking to make sure they don't pull anything off.
When you come in for a sleep study, it's an overnight test. One parent absolutely has to be with them. We don't want kids being scared. We don't want kids being alone. There's a place for them to sleep. If parents decide that their kids are a little nervous and they want to share a bed with them, that's totally fine too. We really want to make it as positive an experience as possible for the kids. And what ends up happening is that you get hooked up to all sorts of different equipment. None of it is painful, none of it breaks the skin. It's all very simple to set up.
The study consists in our center of a very comprehensive EEG, where we monitor eye movements, we monitor airflow from the nose and mouth, we monitor the carbon dioxide that is coming out of the nose, we monitor airflow by pressure.
These monitors help us figure out how well the child is breathing, what their oxygen level is doing, what their heart rate is doing, how often they're moving, and it gives us a lot of information about sleep. On the other hand is the sleep medicine clinic, which is when you actually see one of the doctors. And in those circumstances, basically the patients are coming in for a very thorough assessment of their sleep. We ask all sorts of questions to really get a very comprehensive idea of what the child's sleep is like. And from there we go on to make recommendations about how to proceed and how to take care of the kid's sleep problem.
We're fortunate in that we have one of the larger pediatric sleep medicine programs in the country, probably in the world. Being part of Lurie Children's makes what we do so much easier because we have the full breadth of medical specialties available within an environment that is child-friendly and built for children.